Morning, Dr. Jayashree. Thank you so much for joining me in this podcast, Brain in You.
Good morning, Vandita. Thank you so much for having me in this program today.
Yeah, really look forward to listening from you because you are an exceptionally senior speech therapist. You're a part of AIISH. You are a part of a lot of policy making, so you know what is happening in India. How is India shaping up to take care of autism spectrum? So, just before we start, let me give you a brief background of who the listeners will be. So, I have mentioned this to you in the past that Ayurved works in the space of nutrition, and a lot of these nutritional products are also consumed by the neurodiverse community. So, the parents of those children, let's say between the age group of 2 to 15, primarily 2 to 10, I would say, will be listening to this. So, when you respond to questions, maybe you can keep that age group in mind, or maybe you can, you know, uh, differentiate between age groups if you have different tips for them. But before we start, Dr. Joshi, why don't you give a quick introduction?
Yes, as you mentioned, I work at the All India Institute of Speech and Hearing, which is one of the reputed institutes, not only of the country, but the world now. So we are globally known. And I head a department called as Department of Speech Language Pathology. And I have more than 20 years of experience working at this prestigious institute. I am also the chairperson of the Autism Spectrum Disorders unit at the institute. So I think public people are always something that I've wanted to work with, and especially socialization. So I've always enjoyed being social with people and connecting with people, knowing people. So probably that's the reason I could connect so well with the children with
Yeah,
autism
yeah,
spectrum
yeah,
disorders, and
yeah,
they're very
yeah.
close to my heart. So, and of course, I was very lucky to be placed in an institute like this because you get to work at the policy decision making in the country itself. And I've also been part of the Rashtriya Bal Swasthya Karyakram, which is the national program of the Ministry of Health and Family Welfare, Government of India, for children till 16 years of age. So it becomes very pertinent to be part of some of these
Mm.
bigger, programs of the country, because that's when, you think that as a researcher or as an academician or as a therapist, if there is some concern that you want to implement, it's
Yeah,
important to take up,
yes, yes.
such
100% agree. Yeah, yeah,
yeah,
yeah,
policy decision
yeah.
making bodies. Yes.
So I think that makes it even more interesting and exceptional to have you here, being a part of Aish, which I know is phenomenally known, but also that you are driving change. You're sitting at a place where you can drive change. So
Right.
nobody better than you to answer this question. And this I've asked to many senior experts like yourselves that how do you define autism spectrum disorder?
Yes. So there are so many definitions that you will keep hearing
Mhm,
from many people. Okay. Now, if we have to look at it from the point of a clinical diagnosis, it's
mm,
always better that you take the say of the professionals. Because one thing is there are so many myths running around autism spectrum disorders, and so
mm,
are the definitions. Okay, so everybody now thinks everybody is autism. It's not
mm,
so. So, autism spectrum disorders, as we are saying, has a spectrum of condition. It's a neurodevelopmental condition. It is not something that would happen just because the parents are not giving them enough time, okay, or they do not have enough stimulation at home or around the family or around the environment. But it is a neurodevelopmental condition, which means to say it is definitely related to the brain. Okay, so that's the first thing that we have to remember. Apart from that, there are triad of symptoms that we would like to look out for: social communication and stereotyped repetitive behaviors. So, if you have to say, when socialization is the first most important striking criteria that you would look in any professional diagnostic criteria manuals, and they will tell you that these children have lack of socialization skills. You might see that they are delayed in their social development, which means to say they don't connect even with their family. So they look at them just like strangers. They prefer staying aloof. They don't mingle with other children. So these are the classic traits that you would see. But with communication, you can see that they could have problems in verbal or non-verbal communication. So we often say that non-verbal communication comes much before verbal. So it's the earliest communication thing that you see in babies itself. But it's not so happening in children with autism, even when you see the kid beyond 3 years of age. So it's not only speech that we have to look for, but you also have to look out for the non-verbal aspects. These non-verbal aspects are like your facial expressions, your body language, how your body moves to communicate something. So a lot of times, even though the babies are not able to speak, I'm talking about babies who are less than 1 month, but you could still see the way they're turning their head or the way they're turning trying to turn their body or their hands. That those are the desired things. So they are trying to communicate through nonverbal.
Yeah.
Speech. Speech is so important. And the first thing that parents would come and tell us is, my child is not speaking, even though he's 3 years old or 4 years old or 5 years old, which is quite delayed. But the other important thing is they tell us that he's not even responding to his name. Now, that's very important because there could be reasons why they are not able to speak. But if somebody is not even able to understand their own name or respond to their own name, then it is a red flag. So we have to look out for that. But what I'd like to say is they actually don't have any issues with their hearing. Their decibels are fine, but they cannot respond, or they do not respond, I would say. It's not that they cannot respond, but they do not respond. And that's the classic thing that you would see. The third one that I was telling you was stereotyped repetitive behaviors. And this is something the public usually easily, the layman easily relates to, because you constantly see that the child is, banging his head or rocking the chair this way and that way, or he's just tearing up some papers every time he sees, or he picks up certain things and make rustles and all of that. So these are some of the classic triad traits of autism spectrum, is what I would say. Yeah, Vandita.
You touched upon three traits that maybe somebody can keep in mind, or rather, what defines autism spectrum. But if I were to then go a little bit deeper, what causes autism?
Yeah, so there are various, speculations, I would say, about what really causes autism. You might see that many people are talking about genetics in autism now. So yes, genetics is something that is surely established evidence for autism spectrum disorders. It doesn't mean that it has to come by hereditary, but it could also be genetic mutations that is happening in that child, and that child might be the first generation having that problem. So genetics has come out to be a very important causal factor for autism spectrum disorders. The other important thing is what happens to the mother during pregnancy, the prenatal, natal, and the postnatal factors. So there could be a complicated pregnancy, there could be lack of nutrition or consumption of alcohol or smoking or gestational diabetes. And these are some of the things which are considered as risk factors. Okay, so, and it doesn't just lead to autism, but it can lead to any other neurodevelopmental condition, not just specific to autism. So these are the most well-known causes, I would say. The rest of the others, especially the environment, epigenetics is a lot talked about in autism as well, because the environment started playing a role. But we still do not call them as the causal factors, we call them as risk, because when a child doesn't receive stimulation from the environment, or the parents are not helping them explore the environment, then it can exacerbate the autism that he already has. It can make it worse. Okay, so it
Understood.
may not be a direct causal factor, is what I would say. Yeah.
Understood. And earlier you mentioned certain what what is autism? You gave me some three pointers. Let's say a parent is able to identify those traits early on. So when a parent identifies autism traits, what should the parent do?
Okay, so first thing is seek the help of a professional. But who is the professional now? Okay, so basically in autism, there are a team of professionals. So I'll give you different options that they can go and consult. often it is seen, it is the pediatrician because they are, very much connected with them for the vaccination, immunizations, and all of that. So they could always ask their pediatrician as to whether the child is developing normally or not. And if there is any risk, what is the next thing that they have to do? And you'll often see the pediatricians referring the child to a psychologist because they want that the child is cognitively apt for his age. Okay, so they are sent to the psychologist. Sometimes, the parents might say that, no, he does everything, but he's not speaking. That's when a pediatrician usually refers them to a speech pathologist, and we get cases wherein, the parents come back and tell us that the pediatrician referred us because he doesn't speak. Okay, so that again, so you will see. So I mentioned to you about communication as well.
Yes.
Also, the other thing that you might see is occupational therapists. So, children with autism spectrum disorders can have a lot of sensory issues, which reflects in their behavior. Okay, so like they could have hypersensitivity, they could have hyposensitivity to any auditory, visual, or tactile. So you might see that children do not like certain kinds of sounds. They just close their ears tightly and they just get very aggressive during that time, and they calm down immediately after that. Just like, we can't tolerate certain sounds which are there for
Yeah.
a higher decibel for a longer time. Whereas I'm talking about the normal sounds in the day-to-day environment, which they cannot tolerate, like the noise of a mixie or that of a horn or that of a fan or a cooker
Mm.
and that. So that kind of
Mm.
hypersensitivity could be seen for
Mm.
auditory. Visual, they may not like certain lights. They might find it very annoying. Like some of us like flickering lights and some of us don't like flickering
Mm.
lights, right? And some of us prefer lights while sleeping, some of us don't prefer lights during sleep. But that is all still within acceptable limits. But these
Mm.
kids can't even tolerate certain kind of lights even in the day, like, the daylight, which is very much part of the life. It can affect their quality of their day life because they don't want to come out of the house at all. That could be one of the reasons why they're not out of the house. Tactile sensitivity could be there, because of which they may not like wearing like certain kind of clothes which are
Mm.
maybe woolen or jute or something that's rough. So they might immediately want to take it off, or the mother puts it on, but then they just
Mm.
open it up in the public without knowing whether they should do that or not. So
Mm.
adding on to this, I want to highlight also on oral sensitivity. So it's possible that they may not have a general body sensitivity issues, but they can have oral sensitivity issues, and that's where speech pathologists will come into play as well. So they don't eat specific kind of food.
Mm.
Okay, they don't like to eat certain kinds of food. They
Mm.
don't like to chew. Some of them don't like to swallow certain kind of foods. So it's possible that there are sensory issues in their oral cavity. Okay, because
Mm.
of which you will see they have high preferences to certain kind of foods, and you might see because of that their diet is not balanced, and
Yeah.
you might also see that certain children become very obese as well. Okay, which is
Mm.
not really right for children. Okay, so you need a balanced diet for them. Now that comes to my connection with your nutrition as well. So the moment I talk about balanced diet, you already know that they are going to have nutritional
Yeah.
deficiencies because they don't have a balanced diet. So you'll also see that these kids are going to have to go into meeting the dietitians as professionals. So I have seen that a lot of mothers telling us that we first went to the dietitian because we were more concerned with the food. He was not letting us put anything. Sometimes
Got it.
they don't let them put the hand near the mouth itself. Okay, that itself is very frustrating to the mother. So dietitians have referred us patients like this. So there are host of professionals like that. Special educators are also part of the team. So
Mm.
sometimes it's possible that wherever they have a setup of special education within the inclusive education system, special educators have referred cases to us. So these are some of the rehabilitation professionals and medical professionals that you might, see them. So this is a team that probably sees children with autism spectrum disorders. Yeah.
In the beginning, you touched upon certain signs
Yeah.
which you said define autism spectrum disorder. Now, and you also said that, there will be certain things that a parent may see early on. But my next question is very, very specific. What are some three signs that a parent can see very, very early on?
Yes. So earlier, I should just tell this to the public, especially the parents, because many think that probably they can just go to a professional maybe by 6 years of age or 8 years of age. It's okay to wait and things
Hmm.
like that. But it's not so true. And the diagnosis of autism can be done as young as 18 months of age now, which
Hmm.
means to say there are assessment tools that are available to assess them by that period. So one of my PhD candidates who completed her PhD and was awarded, so she had her battery of tests which could assess as young as 24 months. So in India, I think that is the lowest, age range that you can actually assess. Otherwise, you will see most of the tools which are above 2.5 or 3 years of age and so on. So the early signs that you could see in these children is something that you can see less than 1 year itself. Okay. And
Yeah.
I would not call it as
Yeah.
1 year also. I'm also talking about less than 1 month.
Okay.
Observe, okay? But since we are professionals, we know that we can observe some of these signs and say that whether they fall into typical or atypical. But I would suggest the parents to be cautious and look out for some of these red flags. And if you think that the kids are already having less than 1 month, you can always go to a professional because they can definitely tell you what can be done. So this is more like a preventive rehabilitation, okay?
Hmm.
So you
Hmm.
don't want it to worsen over time, and it could
Hmm.
lead to autism or it need not lead to autism.
True.
There are chance factors every time, but the mother is definitely the right person to do that, like looking at the face, for example. So you see very young babies are constantly looking at the face,
Hmm.
if they want something, and you might see the parents, especially the mothers communicating, do you want to drink milk? How did the mother know? That is not just an instinct, but because the baby is constantly looking at the face, and the basic need of a baby is food and milk, right? So it will indicate like that. So there is something that you can always see, that there is a facial gaze, eye gaze movement, and the baby is looking at that periphery. Okay. So if you think that babies are never making an attempt to even look at the face of the mother or the family members, or he's not even making an attempt through his whole body movement to communicate something. See,
Hmm.
crying is also a way of communicating that it is hungry, and there are different
Hmm.
types of cries. So the babies cry differently for hunger and differently for pain cry, and differently when the baby is in discomfort. So mothers, they are so good at this, and they immediately know that they have to change the diapers, or they have to give them milk, or the baby is in pain or whatever. Okay. So I'm saying all of this is happening less than 1 month. And if there is a baby who's not showing a desire to do that, you have to be cautious. The first most important thing is communication with any ways. That's why I was talking about non-verbal communication. So facial and eye gaze movements are very important. The other aspect to this is social smile. Okay, so you'll always see that because the mother is somebody who's a provider for the baby, right? So the baby is very happy, and it's your behavioral therapy. It gets conditioned. So every time the mother feeds the baby, and the mother smiles, so you will usually not see any mothers be unhappily feeding the baby. Very happy to feed the baby. So it imitates the smile of the mother
Yeah.
to being fed. And the mother is associating again back, saying that, are you happy? Smiling? Did you like it? Do you want more? These are things the mother communicates. And this keeps repeatedly getting associated. So the baby learns to do a social smile with the mother. So you see, if any other stranger comes to the baby will not do that. Okay,
Hmm.
so social smile is also a very important early indicator. And as I said, verbal speech, which I already mentioned to you, by 1 year of age, the child is expected to say one meaningful word. Okay. If they are not able to do that, or if there is a delay in verbal speech, definitely you're going to see some changes. But these are the classic three things that I would like to mention, because
Excellent. Yeah.
yeah, sometimes the stereotyped behaviors, you cannot really make a judgment early of life, because
True.
there are typical children also who will have that, whose sensory motor integration is still taking place, and it takes some time for them to develop those skills, like you might see even typical children rocking, they love doing this with their hands, they're always looking at their fingers. So that sign I have not really found to be an effective predictor in the early years of life. It was only in the later years of life. So I think most of them are, like revolving around the social communication aspects, especially the verbal, non-verbal communication, and social smile and eye gaze movements. These are the earliest signs that you can look out for. Yeah.
That's excellent. And you have multiple times touched on this word verbal communication, non-verbal. And I will tell you at Ayurved also, we get to discuss a lot of speech delay word with our parents, wherein the question is very simple that, when will my child speak? So that's my question to you, that when parents come and ask you, Dr. Jayashree, when will my child speak? How do you respond to it?
Yes, this is something of a very important question. Sometimes the parents just want to hear the word amma or appa, because usually that's the most simplest bilabial that they can
Mm,
produce by first year of age. And if they
mm,
see that the child is just not doing it by 2 years and 3 years of age,
mm,
now that's surely a red flag. So the parents definitely should be told that the child has a huge gap in terms of development of speech. So they have to seek the help of a professional, get the child assessed. And it's not only that, you already know that by 1 year, if they're saying a word, by 2 years they should say a sentence or a phrase with two words, and by 3 years they should combine three
what
words to
sentence?
form a
Mm,
phrase. Okay, and obviously your vocabulary is increasing like anything, because 0 to 3 years is a period when there's lot of potential in the brain. There's lot of neurogenesis happening. There's a lot of myelin sheath formation. There's a lot of synapses that is happening. So that's why we say that the brain is highly plastic during this period. So
mm,
whatever said and done, you do anything during this period, you can get the maximum effectiveness
outcomes.
from it.
Yeah.
So that's why we always say that we should catch them as young as possible and start doing the intervention, especially with speech therapy. Okay. So when parents ask when will they speak, I think it's a highly, variable question. Okay. It depends on so many factors, actually. But on the bottom line, I think it's always the age at which you have identified as early as
Mm,
possible,
very
and you
true.
have started the intervention. So it's not enough if you identify. And it doesn't mean that you identify and just start speaking to the child. You have to, train the child. Therapy has to be given to the child in a manner by the speech therapists. And then you have to see the progress. Okay. So no matter what, the bottom line is, do it as early as possible. But even after that, there's a lot of factors like, give proper nutrition to the child. That is most important. The child might need behavioral therapy. So autism, as I said, is not a homogeneous condition. It's highly heterogeneous. So
Mm,
many times what happens is, because the child is not able to communicate, he's showing up with behavioral problems. It's all out of frustration.
true.
Yeah, or it can be vice versa also. The child is having behavioral issues. Maybe that's why he's not communicating the right way. Okay. So behavioral therapy, it depends on his behavioral problems also and the severity of the problems. So you have to see a clinical psychologist for that. Then it's impossible. No, sometimes see your oral movements require so much of kinesthetic feedback,
Yeah. Yeah.
right?
True. Mm,
Um, so if the child does not have that, and unless and until you have kind of worked on that oral motor sensory aspect of your mouth, the child will never let you touch the mouth. One thing, you can't manipulate and say, do this, speak, speak. You can't do that. The other thing is, that your lips, your tongue are active articulators. So they need to get that kinesthetic feedback to speak. Very simply, if you eat your ice cream, and then your mouth becomes numb. You know how you speak, right? You're not really getting the proper kinesthetic feedback. So that's the example that I'm just saying because I can immediately relate that these kids may not be getting that oral sensory feedback properly, and that is the reason they also don't let their. So this is one theory. They don't let themselves work on the jaws or work on the lips or the tongue, how naturally the other children are going to do. So this is one of the most important factors. The other could be sensory issues. They could have sensory issues that is impeding them from doing any kind of development. So see, there is an age when the children are supposed to be integrated in a more with their sensory motor skills. So it's always the sensory that develops first. So you'll see that the child starts hearing first, starts seeing first, the child starts feeling first. It's only later the child starts using his body or motor movements or even tongue movements and so on. So these are there should be a synergy between these two, right? So if you ask me a question, I listen, but there should be a synergy from my hearing to the brain to the mouth for me to respond back to you. And you will see that this is also something of a huge concern for us. So yes, so I would definitely, I'm just giving you that, tip of the iceberg thing, but there's a lot more to that. I would suggest the parents not to do too much of their own self-diagnosis and intervention. Beyond this, there are other things that a professional is going to look out for, and these are very important factors for them to decide, what is the timeline for the child to actually start.
Yeah.
Okay? Yeah.
100% agree, actually. So I will add to that part where you mentioned nutrition, because that is the part I understand a lot, that a lot of sensory and a lot of behavior issues also reflect from the gut. And the parent somehow gets to miss that, and they run behind a therapist who's doing a behavior therapy, whereas, the child might just be eating something which is not sitting well, and he's not able to communicate to you. So he's showing anger, and you suddenly feel, there's some change. He's now started being very angry. He has no attention span. He's not sitting. There's something I do tell parents a lot, that just for a few days, just focus on the gut. If that's all okay, then move on to other things, because they're not communicating. My next question is actually about social communication, because you touched on this many a times, and you touched on it from the time when the child was just 1 month old. When, if nobody else, and at least the child is socially communicating, or, from his eyes or body gesture with the mother at least, or with the family at least. So, Dr. Jayashree, give me 2 tips on how to improve social communication in any child with autism.
So, yes, so this socialization, improving socialization is the biggest challenge basically in children with autism spectrum disorders. And I want to tell the audience that, see, it is not simply putting the child in a group. Okay, so many people think that if you just put the child in a group of 10 children in a preschool or so, he's just going to pick up, social skills. Now, that is his problem. So just imagine that you are claustrophobic and you're going to be put in that situation. You are going to get more anxious, right? So there's a lot of social anxiety with these children. So this has to be handled in a more behavioral way also. So what happens is, I would say it's all my fellow professionals in psychology department who usually work on that. And it's important to find out that in what context, in what situation, he is coming up with social anxiety or any kind of anxieties that you see in autism spectrum disorders. So usually the social skills is looked at more as a behavioral skill, and it's taken care by the psychologist, and it needs to be taken care by the psychologist. And I'm sure you're also familiar, since you might have heard about principles of behavioral therapy also being incorporated, because communication is a behavior and social is also a behavior. So you need to anticipate, you need to find out, you need to observe. And I'm talking to the parents, I'm not even talking about the professionals, but I'm talking to the parents and trying to tell them, learn to observe your child, just watch them play, just look at them, just see, and also look at the other children. Okay, not because you have to make a comparison, but to know, to understand that, where the child might be lacking and how do they, because, I see parents from both the ends. there are parents coming and telling me, and especially the ones who have the first child, okay, because they don't know what is happening since they don't have experience with another child before, the first child, I'm saying. So these parents, there are parents who are extra careful. And even though it is a normal behavior, they'll come and tell you that, he's very abnormal. He should have been doing this. He should have been doing that. And then there's also another set who will say that my child is completely normal. He has no problem. So there's no acceptance also. So both ways is not right, is what I'm trying to say. So I always tell the parents, please do an observation. It's because I think they spend lesser amount of time with professionals and greater amount of time with the parents. So once they do that observation, they will get to know that there are certain things that will that is antecedent to their behavior. So understand the antecedent behaviors and how do they behave during that situation and what is the consequence of that. So it's that ABC model that we usually want to work on. So a lot of times what happens, you'll have to work not only on the behavior, it's not directly on the behavior, but it is also on the modifications in the environment. Okay, on and probably the modification with the parent also. So why I am saying this is not all children with autism might really have that true behavioral problem, but it's an influence of what is happening from the environment also. Okay, so just like you said, it's also an inherent skill. It's a very implicit thing. Okay, and the child is not able to express, so it is going to become bad and bad over time. So the child might just be telling, trying to express things like, I am not comfortable in the group right now. I want to do my thing, but not able to say it. Okay. That itself will lead to some kind of a behavioral problem. Okay.
100%.
Yeah. So those are the things that you have to really observe. And when it comes to communication, of course, like I said, the very few quick tips that I can say is communication involves verbal and non-verbal. And a lot of children with autism, as I said, have problems in both domains, mostly in both domains. But the lesser severe one, you might see that the non-verbal is a little better compared to their verbal. So you can extract their non-verbal abilities. So you need to find out what are those things that they adopt. See, for example, you might see that a child is simply all the time pulling the mother's sari, just to express something, or, just using some gestures or running towards something. So these might be some of the things that you can extract from them and see how you can convert it to this. Another important thing is a lot of children with autism are more visual learners. But they are not really, they don't learn very easily through just the auditory mode like all the other children would do. So it's always better that you use a visual mode of communication. Okay. So with speech therapists, you might have heard them speaking about AAC, augmentative and augmentative communication. And we have found great benefits with that. So even children who have not been verbal, introduction of AAC has actually helped them speak also. Okay. So that's the thing, behavior is such an implicit thing. I don't think anybody has been able to guess that 100%. Only thing that you can do is how they behave from outside. So if you are able to extract that information, if you are able to observe those information, then you know how you can manipulate
Work
that.
on it.
It's just a reflection of that. Now, what you are doing is you're trying to get deep inside something that you cannot understand. Okay. And you're forgetting about observing the child. You are presuming because you're doing a lot of Google reading and you're thinking that child is going to be like that. So it's not like that. So to the parents, I would definitely say in the initial stages, if you do suspect, seek a professional. Don't do everything on your own. Okay. Even though I'm just giving you a few tips, but don't do it without the help of the professional, because each of these, like I said, social and communication, they all have a hierarchy. And especially for children with autism, there is a structured way of doing it. There's a structured approach that works the best in a lot of children with autism. Yes, in some, you can even do the natural way of doing it. But in most children, in my experience with autism, I have seen that they work very good with structured approaches. And you have to get trained with the professional on that and then incorporate that into their home training. Okay, then they can move ahead with these aspects. Yeah.
So many good points, and I will agree with most of them. I mean, in my journey, see, I'm not a therapist, but in my journey of working and listening to these parents and being a parent myself, I think I've also understood that the first most important thing that made me keep my children calm, and like you said, any neurotypical or neurodiverse can behave like that, is just by observing them. What do
Yes,
you like? What makes you uncomfortable?
correct.
And so that next time I'm more prepared and the child is more prepared.
Right.
And with AAC, that's exactly something that we did. Again, we made a very simple, like a visual aid kind of an app. Says मुझे भूख लगी है, मुझे बाथरूम
Mm,
जाना है, मुझे पेट
mm,
में दर्द है, किसी ने मारा, मैं
mm,
दुखी हूँ. Very, very simple. Some 15, 20, 25 things in Hindi and English,
mm.
basically all regional languages. Because I was telling parents, at least give him a chance to communicate. Speech can
Right.
come. Communication is very important. With communication, behavior will settle down. A lot of things will come out.
Exactly.
So I have learned this in my journey, like you said, that speech is one part, communication is extremely important. And it will
Right.
start by the parents or whoever is the caregiver observing the child very, very closely.
Right.
And lastly, something that you said that I personally feel, because I've seen success in our customer group with parents who are very much involved with the child. When I
Mm.
say involved, they're the ones learning from the therapy or the therapist, and the rest of the time at home, they're practicing or reinforcing that.
Exactly. That's an important factor, all in
Yeah,
their hands. And the kid is connecting so well with the parents
yeah,
more than the
yeah,
therapist. It's the same
yeah,
way. When our mothers used to take care of us, we would love than just a doctor, prescribing some medications. So
yeah.
yes, I totally agree with you too. Yeah, Vandit.
Love it, love it. Thank you. And we have gone from the very beginning when the child is hardly a month old till the child when the child is a grown up. I love that deep explanation, even though you call it tip of the iceberg, but I feel that it is so well explained, all these questions, that it will give parents a lot of very, very clear understanding of what is autism, what are the traits. And you're right. And I think now at times, my generation of parents, we have just started calling every second child a hyperactive child. Hyperactive word is being used so
Yeah,
loosely now.
so
We
common,
just,
right?
yeah, and we find every other child to be on the spectrum. Uh, I think the uh, the indicators that you shared, and they're just indicators, I agree. Um, Yeah, parents have to very closely observe, look at the other children, and then start drawing judgments instead of, like you're saying, they're trying to be too overprotective.
Exactly. Yeah.
So, thank you. Yeah, I think I
Mm.
just love this.
Yeah.
Thank you. This is very, very useful.
Mm.
Thank
No,
you
that's
so much. Yeah.
yeah, that's the thing. See, what happens is even in the normal curve, there are variations. It's a bell curve always. You will see that there are some concentrated in the center. So
Mm,
it is a possibility that your child might come at the highest scores or at the middle scores as well. But that's why I said we are there as professionals. Don't worry too much and just seek the help of the professional before you diagnose. Otherwise, there's a lot of anxiety in parents
mm,
themselves. So
mm,
50% of your problem gets solved when you know whether the child has a problem or not. Only the
mm,
and the acceptance, of course. So that's also the theme of this year's thing that we started off with
mm,
awareness of
mm,
autism, and then we said they
mm,
should be included in the society. We somehow
mm,
included, but we hadn't accepted yet. But then we
mm,
started accepting, and this year we have started celebrating autism. Now that's what is more on the plate, because I'd like to always say that celebrating neurodiversity is something that we have to incorporate. We ourselves thinking that it's okay, they are different brains. Okay, it's okay because they function differently. How many of us are can we be called typical? Some of us are tall,
yeah,
some of us are
yeah.
short, some of us are shy, some of us are so expressive, some of us are introverts, extroverts. We are all neurodiverse in that way, if you see. So when you have accepted, why don't you accept? And you can see the biggest change in the life of that whole family. I'm not even talking about the child. And
Yeah.
that matters. The moment somebody tells you that it's okay, I know about it, it's fine. You can get your child to my home. I know his problems. I know his meltdowns. I understand he's a child with autism. So it can make such
Yeah,
beautiful life of that whole family, not just the child. Yeah.
very true. Yeah. Absolutely true. And I was speaking to one parent. I kind of go back referring to him many a times that he said, Vanda, I was trying to fix my child. And there was a day when I went up to him and I said, I'm sorry. You're
Mm,
not a machine to be fixed. And
exactly.
that was the day when he said the child just changed forever. He
Mm,
was like on an upward curve. The whole family was celebrating. There
yeah.
was just success all around. So
Yeah.
I think I agree with you. Yeah.
Yeah, and see, that's the thing. Autism kids, you many times you can't make out from their external features that they actually are having some issues or it's a condition.
Mm,
But
mm.
the parents have to be very cautious of what they are speaking in front of the child
Yeah,
because the child might be understanding. He's only not able to express it the way you're expecting him to express.
very
So just
true.
be careful. Just like any other child, it's important that you talk more positively about the child,
Mm,
because he might be grasping. A lot of children, especially those children who don't have a cognitive deficit, or a comorbidity, they are all understanding.
very
So
true.
I want the
Very true.
parents, this is an urge to the parents, just because they look like they cannot express, don't speak whatever you want. Just be very careful when you're speaking to the
In
child. It
front
can
of
make a
them.
big
Mm,
difference, actually. Yeah.
very true. I agree. True for any parent, rather.
Yeah.
Thank you so much, Dr. Jayashree. I just loved the session today. I learned a
Same
lot.
here. Yeah,
Mhm.
absolutely. It was fun talking to you as well. I'm not sure if we have exceeded the time limit.
That's okay. Don't worry about it.
Yeah, but I
This was
think,
very important because going in detail and you, with your experience, the way you spoke, the way you segregated elements, I think that is extremely directionally important for the parent. So,
yeah, yeah. So
yeah,
I'm glad. I mean, I think I made some justice to this
yeah, you
problem.
did a
So
lot.
much.
Thank you. Thank you.
Thank you. Yeah.